Okay, I think we're live. Hi, Cynthia.
Hey, how are you?
I'm good. How are you?
Good.
All right, you guys, if you are jumping on or catching the replay, I'm so glad you're here today. This is a really exciting interview that I have lined up for you. Real quick, my name is Katie Harlan, if you're not familiar with my brand. I'm an online health and fitness coach. I'm a digital marketer, and I work with women and men, entrepreneurs, helping them get their business into the online space. And I'm also the creator of If You Carb Cycle, which is a carb cycling and intermittent fasting program that we actually have launching again on Monday. So if you're interested in that, be sure to contact me so you can get a spot. I am so excited today to be talking to you. I have my friend Cynthia Thurlow here today, and she is going to be talking about a topic I'm super interested in, which is gut health. And the way that we met is because we are part of a network of amazing and really smart women who all come together for the purpose of bettering women's health and wellness. And we all kind of have different niches and different areas of expertise. And Cynthia, one of her areas of expertise is on gut health. So I found her and I really wanted to bring her on. So Cynthia, will you go ahead and introduce yourself and tell us a little bit about yourself?
Absolutely. Thank you for this introduction. So I am a nurse practitioner. I'm also a functional nutritionist, and then my best title is mom and wife. But I have begun to really kind of carve out a niche in helping support women. And functional nutrition really believes that our health is really derived in our gut. And so it's become an area of specialty, as well as, looking at hormonal health of adrenals and thyroid. But it really has become apparent to me how little Western medicine really places value on gut health versus functional medicine. Just a tremendous area of interest and focus, not only for myself and my family, but also for my clients as well.
Okay, so for people who are not familiar with gut health, can you just kind of define leaky gut and why should we care about that?
Sure. So leaky gut has become kind of a catch-all phrase, but really describes the impact of our small intestine and hyperpermeability, which is a big fancy way of saying that the integrity of the tissue in the small intestine has been compromised. And so when you have compromised cell tissue, then you have proteins and foods that'll leak directly from the blood, and that can kind of set up a lot of health problems that we're seeing with greater frequency. So a lot of the focus that I do with clients is, first of all, ensuring that they don't have leaky gut, but if they do, ways that we can address gut health. But also ensuring that for the people that don't have leaky gut, that we do everything we can to optimize digestion, ensure that they've got good quality hydrochloric acid, which is produced in the stomach, helps us break down protein, as well as ensuring that we're producing really good quality bile, which helps our body break down fats. And then with the other, hormones that go along with digestion, just ensuring that we're getting the best quality food that we can consume, and then ensuring that, the end result digestion is the elimination on a daily basis. So that's in a nutshell. But leaky gut is not something that necessarily everyone is dealing with. It is increasingly very commonly seen in the United States and beyond.
That's really helpful. And, I was really interested in this topic when I started reading about it, thinking or realizing that people that can be doing what seems to be everything right as far as nutrition and exercise and water intake and all of that can still be dealing with this problem. And I definitely think I'm one of those people. And the reason I think that I was dealing with it is because I was on antibiotics for the first 5 years of my life for ear infections. And it was kind of before they did a lot of tubes. And
Sure.
so can you talk a little bit about that, Cynthia, about how antibiotics can affect your gut?
Sure. And so, antibiotics do play an important role. I don't want to tell people that antibiotics aren't valuable, but if you are on them chronically, like you said, you were on and off them for 5 years, or if you're on them for a prolonged period of time. I'll give you an example locally. The area in Northern Virginia that I live is endemic for Lyme. So you have people that are on long cycles of antibiotics. So antibiotics are designed to kill bacteria that are making you sick. Unfortunately, sometimes they're not prescribed appropriately. Sometimes they're prescribed when someone really has a virus. But what they also do, and one of the detrimental things that they do, is that they can wipe out the good gut flora, good bacteria that we have in our gut. And so we know that 70 to 80% of our immunity is in our gut. So if we wipe out the healthy bacteria that should be there, it really sets us up for chronic, kind of long-term impact. And the other thing that it can do is that it can not only create that imbalance, but it can also lead to leaky gut that I kind of touched on earlier. And so it will say to me or patients, I was on a course of antibiotics for Lyme, as an example, and then a couple months later, I developed an autoimmune issue. And the things that I see most commonly are things like Hashimoto's, which is an autoimmune thyroid issue, psoriasis, eczema, a lot of those issues, lupus, that you'll see things that will develop later on. And sometimes Western medicine doesn't make the correlation, meaning, we're not taught in Western medicine that a symptom is necessarily derived from an action that occurred earlier, whereas functional medicine. So, for example, you were on antibiotics for 5 years. And I think when people are younger, sometimes the impact of antibiotic use is not as significant as it is as we get older. So if you were to have developed eczema, later in your life, if you were to develop psoriasis or something like that, you could probably make that correlation that was related to a disruption in the healthy gut flora and some degree of leaky gut that developed subsequent to those use of antibiotics. But it's definitely becoming a larger issue as we see more and more autoimmune issues that are kind of developing.
And would you say that the Western diet of overly processed foods and, poor farming practices and this and that and the other are partly to blame for more people having this?
Absolutely. I think a lot of the sickness that we're seeing overall in the United States is related to that standard American diet, which I hate saying, but, you're talking about a highly processed, poor quality salt, iodized salt is a poor quality. The fact that there's a kind of disruption from, the practices that are families had 50 years ago, where the soil had much more vitamins and nutrients in it than it does now. Conventionally raised animals, whether it's beef or pork or chicken, etc., are being given hormones and are actually developing a lot of the diseases that we're seeing in adults and children.
All the sugar, sugary drinks and that kind of thing. Surely that's got to affect the gut too. So how then,
Totally. And sorry.
Oh, I'm sorry. I was just going to say, how would somebody, if somebody's watching this and they're like, I didn't know about this. Maybe I do have a leaky gut, but how would I know? So how could somebody, kind of self-diagnose or look at themselves? Like, what symptoms would they be showing if they have a leaky gut?
Yeah, so a lot of things can be GI related. So it may be bloating. They may have constipation. They could have diarrhea. They may notice that they're having a reaction, not referring to an allergic reaction, but you could be developing food sensitivities, skin manifestations. So if you've got rashes or you've got acne or eczema, psoriasis, I always indicate that, skin issues are internally. Those are the things that I typically will see. And I that, a lot of people, as they start adjusting diet, if they start seeing those things and symptoms, I'm not a fan of self-diagnosing. So I always say, start with food, scale back on what you're doing, change there. And if you have persistence, then I think there's value in working with someone who has functional training so that they could do testing if necessary. And sometimes testing involves food sensitivity testing. They may be looking at stool to see if there's candida or a type of disruption, a lot of inflammation in the gut that we will see on stool testing if someone does have leaky gut. Sometimes, they need a full workup with blood too, looking at thyroid, looking at other digestive markers, adrenals if necessary. So there can be a lot of different testing, but I would say the first thing that someone can do on their own that's not expensive, not complicated, foods that are more processed, start eating more probiotic rich foods, and that doesn't have to be complicated. And I know there are plenty of women out there that probably make their own kombucha, make their own fermented veggies, but nicely, most supermarkets now, or fairs, grocery fairs will have fermented vegetables, whether it's sauerkraut or pickles, or that you can definitely use on your own. Things like kombucha and kefir are great ways to kind of start your diet. So there's a couple things that you can do on your own that don't require testing. But if those aren't working well for you, then the things I identified would also be helpful.
Okay, so anyone can benefit from improving their gut health, even if you don't have a leaky gut. We can all improve the integrity of our gut, and so some of the ways to do that are kombucha and kefir, like you said. Mm-hmm. Do you recommend taking a daily probiotic?
I do think there's value. I think, purchasing a really good quality probiotic is important. A lot of the stuff that people can buy over the counter at GNC or Costco or the grocery store, there's little value. Most of the bacteria that's in there is already dead before it ever makes its way to market. So purchasing a good quality product is important. And something that I want to touch on that people forget about is that in our very stressed I don't think anyone, bless you, I don't think anyone's immune to it. If your mindset is not in the right place when you're eating food, your body's not going to digest well. So we know that digestion is a north to south process, meaning it starts in the brain. So you can't be running errands and digesting food. So I always encourage people to take a couple minutes, really more than a couple minutes, but take 10 or 15 minutes if you have it. And don't be driving in your car. Don't be running around your house eating and trying to feed your kids and trying to eat at the same time, because your body's not primed to accept food. And so what I'd mentioned to and alluded to earlier is that digestion starts in the brain. We know that parasympathetic mode, our stomach will start increasing hydrochloric acid secretion in anticipation of food being consumed. And so that's where protein starts. And so I always encourage people, and an easy, inexpensive thing to do is just make sure that you're not constantly in a stressed mode when you're trying to eat food.
I love that advice. I just watched a documentary last night in defense of food, and they were talking. One of his tips was, eat like the French. They sit down and make an event out of every meal, and while that isn't necessarily practical for us all the time, I think it is great advice.
We as Americans, and I always hate all of us into one group, but we traveled abroad with our children a few months ago, and that was the one thing that my kids really enjoyed, was that when you went to a restaurant, you didn't get food immediately. You weren't immediately having all your dishes removed and expecting to pay a check and leave. Yeah. They actually enjoy the process of lingering over food and just enjoying one another's company. And I think to your point, we need to do more of that. And not realistically, especially if you have children at home, it's with every meal. But I encourage my clients that, when their kids are back to school or their spouse is at work or however it is that they work it out during their work day or their daily existence, take 10 or 15 minutes once a day to just enjoy a meal. I know that it's something I savor. My kids know that that's something that I'm very protective of. That 10 or 15 minutes is just mom's time. But not to be distracted looking at the computer, answering Facebook messages, returning phone calls. Do something that brings you joy and provides some degree of relaxation, and just enjoy a meal.
I love that. I personally love to take my food outside and sit and just soak it in. But it's funny how 10 minutes can really feel like a very long time in this busy, busy world. So Absolutely. Cynthia, Going back to just a little bit, I just want to make sure it's clear for everybody watching. If they feel like they might have a leaky gut and they want to do further testing, what is a homeopathic doctor the best route, or is there like an online service? Like what would you recommend for them?
We have providers that are functional trained, and functional training really permits a physician, a nurse practitioner, a PA, use testing, and they have then a traditional Western medicine. And so, here in the United States, I know naturopathic doctors are an option, but it's really based on states' laws. So some naturopathic doctors have more autonomy in some states than others. But there's an organization called IFM, and you can get on, I think it's www.ifm.org, and you can plug in your address or your zip code, and you can look for an IFM trained healthcare provider if you need someone like a physician or an NP or a PA. And then there are many of us like myself. I'm a nurse practitioner with functional training, and I do testing. I work with clients throughout the country, helping to kind of get some answers for symptoms that they're experiencing, but really looking for someone that has functional training. It could be someone that's a nutritionist. It could be an NP, a PA, or a physician, or a naturopath. It really just depends. And even some chiropractors do that kind of work. But again, it depends on the state and how autonomous they can be. Some states are easier to practice in than others.
That's super helpful. So if people watching want to get in contact with you, Cynthia, what can you tell us about that?
Sure. So probably the easiest way is you can just jump on my website, chtwellness.com, and there's a contact page, and it'll absolutely send me an email. You can also email me directly at Cynthia, Cynthia, at chtwellness.com. And I offer a 30-minute complimentary consultation if anyone's interested in, figuring out a little bit more about how I work with clients and the work that I do. I think that there's lots of options. And the one thing that's really neat is that I'm part of a larger nutritionist group. And so sometimes I will have people make inquiries who aren't in my area of expertise, but I can always refer them out to colleagues that have specific training if they have something very, very specific that they want assistance with.
Okay, that's super helpful. I'll probably reach out to you. I'd love to get tested. I just love collecting data, and I think it's so empowering when you know about your own body. And that's what I've really been on a journey to do in the last year or two, is just really learn. I call it the study of one, and just get all the data on myself that I can, and use that to, build my perfect plan for my own body. And that's what I like to teach my clients to do as well. So that's really, really awesome. Before I let you go, if anybody's watching this, I was trying to hop on my phone to see if anybody's watching this with questions. I can see your questions, so I'll give you, you guys have a few seconds if you want to type a question in. We can try to answer that. And anything else, Cynthia, before I let you go that you wanted to touch on or add to this discussion?
Yeah, I would say, the big thing, you had touched on probiotics, and I do think that there's definitely value in taking probiotics, but it's always based on, what someone's needs are. And that's where bioindividuality, all of us are our own individuals. So making sure that you get a tailored recommendation, because I would hate for someone reached out to me recently and said, I spent $80 on these probiotics and they didn't work well for me. And she went from having regular bowel movements to being horribly constipated. And that's where there's value in, getting some input from someone that's trained in those areas so that you get the right recommendation and you're not wasting money on products that don't work well for you.
Yeah, totally. There's anybody can slap that, a lot of this isn't FDA approved. And so, I've read a lot about how, some probiotics, they'll advertise, 20,000, I don't know the word.
Yeah.
Yeah, but then if you look at it, it's only maybe 2 types of bacteria. And so I love this analogy of thinking of your gut like a rainforest. And rainforest, you need to think of all the, tens of thousands of different organisms in a rainforest. And so we want our gut to look like that rainforest. And so if you're only introducing 2 different bacteria, that's really not that helpful. So when I buy a probiotic, I try to look for something that has a larger number of enzymes and bacteria.
Yeah, and so, different strains are important, and different strains there can be value for using different strains with different individuals. And I think that, the quality is important, making sure you're taking the right one. And with some of my clients, we rotate between 3 different types of probiotics. They'll take one bottle for a month, we'll switch on to another one. And so I always explain to them, I always make the analogy, we want as much variety in our gut garden as possible. I know you kind of made that analogy as well. And so we don't want weeds in the garden. And that's why it's really important to try different. And that's why, using both probiotics and prebiotic rich foods, and then also probiotic capsules can be really beneficial, trying to keep that variety going as much as possible. And so if we know that 70-80% of our immunity is derived from the gut, it's really, really important that we support our gut as much as possible.
Okay, awesome. And I don't think I have any questions. Oh, I just pulled this up. Sorry, I pulled this up on the phone. There's a delay. Okay, well, thank you so much, Cynthia. I know you've got kids stuff to do, and I've got a little one in the other room too, so I'll let you go, but I really appreciate you being on with me.
Yeah, thank you so much. This is great, and I'll have to bring you on and have you talk about carb cycling with my clients as well.
Yeah, I'd love to.
Topic of interest of theirs, and I know that's an area of expertise for you.
I would love to do that. Thank you so much. I hope you have a great day.
You too. Bye-bye.
Bye-bye.
Bye.